65-year-old female patient with long history of chronic fatigue, dysautonomia, so autonomic dysregulation like POTS and stuff like this, tachycardic episodes, sleep disturbances, and various things. Tick bite at age 20. This is probably a Lyme-associated chronic illness here. A lot of viral reactivation, especially EBV, CMV, Coxsackie, which is a gut virus, and enterovirus. A lot of adverse childhood events and early childhood trauma. That's important and a common feature in some of these cases too. Diagnosed with fibro at the end of the 20s, had a lot of chronic pain, and then the really immense fatigue, kind of happened later, incidentally, with some sort of gut event, which is kind of interesting, isn't it? The sequelae, or what was lingering within this syndrome, was a lot of viral activity and mitochondrial dysfunction and dysautonomia, autonomic dysregulation. So if we were able to treat and mitigate the viral activity, support the mitochondria through a lot of the foundational things, and then sort of work our way up into some of the higher order items. Once you get to that point, you're like, okay, we've improved, so far, but we're not quite to the level of function we want to be. We're looking at more complex metabolics around chronic fatigue syndromes. But let's just say we've gone through the usual suspects. We've gone through the usual things that work clinically. It might be good to think about doing a more directed mitochondrial support with mitochondrial peptides. And so the older we are, our mitochondria don't necessarily respond as quickly and as favorably, but yet in this case, we were still able to create a significant change.